Welcome to Hersing University NU 640, Introduction to Women's Health Across the Lifespan. This video will build upon Unit 2 and will discuss the remaining sections of Chapter 8, 9, and 10, Young, Midlife, and Older Women's Health, along with Chapters 12 through 14 from your Alexander and Colleagues textbook. This discussion will serve as a brief overview of the material. Therefore, I would like to ask that you please read the chapter for additional and required information. Additionally, I would like for you to review all other required and supplemental resources. This lecture will be narrated both by myself and Dr. Alicia Sutton.
The delivery of healthcare services aimed at the prevention of physical and mental illness and disease is defined on 3 levels. Therefore, I believe a good starting point for us is to briefly review primary, secondary, and tertiary prevention. I know that it is elementary for many of you, but I can assure you that you will see this in some form on your boards. So let's just take a few minutes to recap our driving forces, and then we will dive into the recommended health promotion and prevention guidelines. The practice of well woman health is not a reactive healthcare system that responds to acute and urgent needs, but rather one that nurtures health and well-being. Therefore, you will always intervene at the lowest level possible. Primary prevention is considered the lowest level of healthcare. These services focus on preventing disease in susceptible populations. So what's the goal of primary prevention? Preventing the health problem. It is simply considered to be the most cost-effective form of healthcare. Examples of primary prevention efforts include health education and counseling about safety, injury, and disease prevention, along with targeted immunizations. Secondary prevention services focus on the early detection of disease states and subsequent prompt treatment that will reduce the severity and limit the short and long-term impact of the disease. This is detecting disease via the screening test. It is not differential diagnoses, follow-up in established disease, or disease treatment. Examples of this include screening tests such as mammography, blood pressure checks, and colonoscopies. Tertiary prevention services limit disability and promote rehabilitation from clinical disease states. It is minimizing negative disease-induced outcomes and can be viewed as failure of primary prevention. Examples in established disease, adjusting therapy to avoid target end organ damage. So let's think of primary as preventing, secondary as screening, and tertiary as treating. In Unit 3, we are only going to focus on primary and secondary prevention efforts, such as counseling and education, immunizations, and evidence-based guidelines. You, as the provider, will be in a prime position to offer information that provides your patients with the tools needed to maintain a healthy lifestyle and assist in altering behaviors that may cause harm or illness. Women often seek information during their yearly physical examination that can guide them in making lifestyle changes and confirm that their current practices are an effective means of maintaining health. Therefore, you as the provider will need to be aware of these topics and recommendations. The United States Preventative Services Task Force guidelines recommend that in combination with regular oral hygiene practices, all women should be counseled to seek regular care from a dentist. All women should limit the amount of fat and cholesterol in their diet. Women's diet should contain a variety of foods, particularly whole grains, fruits, and vegetables. Studies reviewed by the task force found that women who follow these guidelines have lower rates of morbidity and mortality from coronary artery disease and certain forms of cancer. It is also important to note that young women are at particular risk for establishing distorted eating patterns during periods of marked change, especially during the transitions of late adolescence. Additionally, all women are advised to consume the recommended daily allowance for calcium and to participate in regular physical activity to reduce both bone mineral loss and the risk of osteoporosis. In addition to slowing bone mineral loss, regular exercise reduces the risk of developing diabetes, obesity, heart disease, and hypertension. Injury prevention is also important because motor vehicle accidents are the leading cause of death for people ages 1 to 34 years. ACOG recommends that all women be encouraged to use lap and shoulder restraints. The guidelines also encourage counseling on the dangers of driving under the influence of alcohol or riding with an impaired driver. Please do not forget to also include education about the use of helmets with any ATV, motorcycle, or bicycle use. The task force advises counseling older women about preventing falls because fall-related fractures increase the risk of further decline. The prevention of falls is a top priority. The United States Preventative Services Task Force also recommends high-intensity behavioral counseling to prevent sexually transmitted infections for all sexually active adolescents and all sexually active adult women. Counseling should be based on individuals' risk factors, which can be assessed during a careful drug and sexual history. Patients identified as being at risk need to receive information about ways to decrease their risk, such as abstinence, maintaining a mutually monogamous sexual relationship with a partner who is not infected, regular use of latex condoms, and avoiding sexual interaction with individuals who are at increased risk for STIs. And in light of the fact that more than half of all pregnancies in the United States each year are unattended, the task force recommends counseling all women who are sexually active with male partners about effective contraceptive methods. The prevalence of substance use and abuse has prompted the recommendation to ask adolescent patients about substance use during the confidential portion of the health visit. The CRAFT screening tool was designed specifically for adolescents and has been repeatedly validated. 2 or more positive answers suggest a significant problem with alcohol or other drugs and necessitate further evaluation. One disadvantage of the CRAFT screening tool is that it does not screen for use of tobacco products. Tobacco use poses a tremendous health hazard. Tobacco-related disease results in a significant burden to public health and healthcare costs. You as a provider will need to consistently identify and document tobacco use status and treat every tobacco user seen in your healthcare setting. So what are the components of a brief intervention for treating tobacco use? The answer is A, ask, advise, assess, assist, and arrange. I hope that you are all aware of this intervention by now, but again, I wanted to include this as a review because you need to become very familiar with it. This strategy should be employed with all tobacco users, including individuals with no current desire to quit, because this can serve as a motivating factor in future attempts to discontinue tobacco use. In addition to counseling interventions to assist patients in making healthy lifestyle choices and changes, primary prevention includes the delivery of targeted immunizations.
The Centers for Disease Control and Prevention has released new or revised recommendations in the 2024 immunization schedules. I will not review each of those changes here. Rather, I would like for you to review the Adult Vaccines and Immunizations Update video by the AMA. I have also provided you with the Child and Adolescent Immunization Schedule as a required document. I will always recommend that when you find something that helps you out in practice that you print it off and keep it in a binder to assist you in the future. Likewise, I have provided you with the Adult Immunization Schedule as a required document.
Lastly, I've provided you with a summary of maternal immunization recommendations as a required document. When considering appropriate vaccination schedules for women, it's important to note that the measles, mumps, and rubella, or MMR, and varicella vaccines are contraindicated in women who are pregnant or women who are immunocompromised, including some women with HIV infection. Live virus vaccines are contraindicated 1 month before and during pregnancy because of the theoretical risk of virus transmission to the fetus. Sexually active women in their childbearing years who receive live virus vaccines should be instructed to practice careful contraception for 1 month following receipt of the vaccine.